So after a hip and knee replacement, the process is similar for really both those surgeries. We're going to keep people comfortable in recovery and then get them to their room and then have therapists see them. So the therapist will get them up initially with a walker. We use a walker for balance control. The joint replacements are stable right away. They're able to put full weight on the joint replacement and walk on them. In fact, we really want them to walk with full weight bearing and get used to walking with the joint replacement. And so we start with a walker just for balance control and then get them going. And the therapist will actually have them walk up and down stairs right away after the surgery to learn how to walk up and down stairs. We'll also make sure they're comfortable, make sure they have all the medicines they need to go home, including discussions about how to control discomfort, icing the extremity to help with pain, what medicines to take. We'll talk about all the different medicines we're going to give them to control pain, to prevent blood clots, and to make them comfortable. And then we'll make sure they're able to do all the things we want to see before they go home. So before we let anybody go home, we make sure they're able to go to the bathroom, we make sure they're doing well with therapy, we make sure their vital signs are okay and their pain is controlled. And then generally people are ready to go home. Before they go home as well, we have care managers that make sure that the patient's therapist is set up. So generally we'll get a therapy plan either at home or an outpatient therapy center to start right away after surgery to get them going with therapy. And we make sure they know everything they need to know with some written instructions about how to succeed after surgery. It's important for patients to know what to expect after surgery, and that includes when they will probably go home. You know, they need to kind of prepare for that with support at home and people who's going to be home with them and who's going to drive them home. So really the goal is to really educate the patient about what to expect after surgery and discuss in the office before surgery when we think the patient will go home and what they want to do. So a lot of patients really want to get out of the hospital as soon as possible and go home and sleep in their own bed. Other patients are more hesitant. So educating people about those options and how we can make that work best for them is important before surgery. And then after surgery, we make sure they meet all of our criteria to go home. So nobody leaves the hospital if we think they're not going to do well. And in order to go home, we need to make sure people are comfortable, they're going to the bathroom, their pain is controlled, they do well with therapy, they understand all their postoperative instructions, they know who to call if there's any issues, they have social support, they have a ride home, they have all their medicines set up. So this is all done, either before or during the hospital stay to make sure that they're going to succeed. And so whether the patient's going to leave the day of the surgery or the day after the surgery, that's kind of the same process and the same criteria we use to make sure that people are going to do okay. And that's generally when people are ready to go home. Back 10 years ago, patients used to be flooded with a lot of narcotics to stay comfortable, or they would have a catheter in their back that would make their legs numb. And so if you had a ton of narcotics, you didn't feel well, you got nauseous, and you got off to a slow start. If you had a catheter in your back that makes your legs numb, you can't walk very easily at all. And so you're laying in bed and you're staying in the hospital for days and days until you're okay to get up and walk with therapy. These days we're able to do good anesthesia techniques with injections that allow people to have pain control but stay functional. So especially with good anesthesia, people are lucid immediately. In the recovery area, they're able to talk and feel normal and feel great and look good. And then with therapy, because their leg is not asleep and their pain is controlled, they're able to get up and walk well and do therapy easily and get up and down stairs right away because they feel good and their brain is not foggy and they're not nauseous, but they're able to walk comfortably. And so that's really the biggest advance that lets people safely get out of the hospital quicker is really better pain control and better anesthesia. It also has to do with good, efficient surgery. So as the surgery itself has gotten better, we've been able to really get people to have less pain because of the techniques of the actual surgery itself and do less soft tissue disruption, so therefore people are more comfortable and don't need as many pain medicines. And we're also able to get people through kind of more efficient surgery and quicker surgery. They're not under anesthesia as long, and therefore their brain feels good and they're just more lucid afterwards. So for all those reasons, it's really possible and really standard these days to have people go home the day of the surgery. There's things really that are going to kind of ensure success with hip or knee replacement. And so I always tell patients before surgery, you want to be physically and mentally ready for it. You want to have good social support. So a lot of our preoperative education really focuses on that, making sure people understand what the process is going to be, what their recovery is going to look like, the resources they'll need to get better. So really learning about the process, attending the educational classes, physically getting ready. Some patients are in really good shape before a joint replacement. Some patients have been in a wheelchair for months and they're pretty debilitated. So that's the case where preoperative therapy can help a lot. lot, really get people's muscles in shape. But simple stuff like good sleep hygiene and coming in with good energy and having the mental and social support to succeed with a joint replacement really helps. And then after surgery, really just listening to our instructions about what to do with therapy. Some patients actually feel so good that we have to tell them not to do too much. Sometimes we say, okay, you're going to focus on walking and gentle motion and maybe a stationary bike in a couple weeks, but please don't go try to hike, 6 miles at a time or do a spin class in a week or something like that, because honestly, especially some younger people that are healthy feel so good, they want to do that, and sometimes it can kind of stir things up and cause a little more irritation than needs to happen. So sometimes we have to slow people down, but really learning about what to expect after surgery, knowing ways to prevent problems, and so getting up frequently and mobilizing quickly and icing the extremity for pain. Simple stuff like that patients will learn about before they come to the hospital and then while they're at the hospital. All the things that they'll learn, kind of simple things, will help them succeed afterwards. So the recovery for hip and knee replacement are both pretty similar. The hip replacement is a little easier recovery and a little quicker recovery than a knee replacement, just because of the nature of those two joints. For a hip replacement, the typical recovery is people have surgery, they leave the hospital the day of the surgery very commonly, or at least by the day after, and then therapy at home for a couple weeks. So usually about 2 to 3 weeks of therapy. And there's a little difference between the side. For instance, a left hip can drive sooner generally than a right hip because the right leg has to go up and down on the gas pedal, but it's really common for patients, especially with a left hip replacement, to be able to drive within days, and even just a week or two for a right hip replacement. It depends a little bit on the patient. We have to use our judgment, but it's a quick recovery and quick turnaround. And so after that initial therapy for a few weeks, most patients at that point are able to do therapy on their own, ride a bike, go to their gym, and start working on progressively getting better and better from a recovery standpoint and a strength standpoint. Knee replacement's a little more therapy involved. Knee replacement is a little bit more achy. So usually I tell people for the first 2 weeks after a knee replacement, you're going to be a little bit achy. You're going to be working on motion and mobilizing, just getting up frequently to prevent problems and get your energy back. And then after the 6-week mark with knee replacement, usually people are able to start doing most of the things they want to do, like go on trips and have fun. And they're not normal yet, but they're better to the point that they're really functional and able to enjoy trips and kind of normal day-to-day type stuff. And that's probably about at least a 2 to 3 week increased recovery in terms of a hip replacement. And that's a total knee replacement. Partial knee replacement recovery is actually pretty similar to the hip replacement. Partial knee replacement patients really recover quickly, just like a hip replacement. Total knee is a little bit longer.